Hello and welcome to today's podcast brought to you by ISCCM, where we explore the forefront of critical care medicine. We are honored to have Dr. Pradip Bhattacharya sir with us. We all know him as the President of Indian Society of Critical Care Medicine. He is a professor and HOD of Critical Care at RIMS, Ranchi. He is also the Dean of Research and PhD Coordinator. He is also the in charge of trauma and central emergency there. He is a distinguished leader in critical care medicine and is known for its contribution in the field. We welcome you, sir.
Thank you for inviting me.
Welcome, Professor Pradip Bhattacharya to ISCCM Vodcast. So let's discuss the ISCCM per se and your experience and your tenure in this vodcast. So my first question to you is, ISCCM from the inception over the last 30 years has gone leaps and bounds. So we would like to listen from you. What is your take on the growth of ISCCM and how far we have reached in expanding intensive care practices in India?
Okay, Jacob, actually, I tell you, I joined, I first I attended this ISCCM meeting in Bombay Hospital, and that was organizing secretary was Dr. Praveen Amin, 1995. That was my first conference which I attended, and it held in Matusri Auditorium of that Bombay Hospital, and I got so much attracted towards this field because I basically was doing anesthesiology, and when I saw that yes, what is the right way and what should I choose as my future, at that time that instinct came to me, and that yes, critical care is the subject which I should look forward. But obviously, everyone thinks that how you are going to get the openings, that is very important. Okay, it is basically luck also. So I remember the how it started after I finished my residency and everything. 1999, 2000. I remember that at that time, after finishing my residency from All India Institute Medical Sciences, I thought, how should I go for critical care? Because I did almost 1 year of training in All India Institute Medical Sciences in critical care, and after that, I was looking for a good opening. So I went across many institutes, and Gangaram was one of those institutes in Delhi. But somehow I got convinced with my one of my teacher. He said, if you want to grow, you join an institute. And AIMS is currently full of faculties, and no permanent appointments are being done. So better you take and go to Bhopal, and you will see that you are getting whatever you expect from uh, your critical care subject. So I went, I joined a super specialty hospital on the advice, because my selection, everything happened in AIMS. All the drivers were sitting in AIMS, and I joined that hospital in Bhopal. That was a tertiary care hospital, Bhopal Memorial Hospital and Research Center. I remember 450 bedded hospital, huge one, and all super specialty discipline. And that was the starting. I first independently started a critical care setup in Madhya Pradesh. It was year 2000, June, I remember. That was my first venture. That is how I started my career. As far as attending this ISCCM, after that, I regularly started 2001, 2. I remember Delhi conference when I got interacted with so many international faculties and all senior leaders of our country. That was the point when I met. And thereafter, there is no look back. I remember 2007, it was Chennai when this conference was going on. I was here and I was very keen to do this national conference in Bhopal. And I had to bid for that. We placed a bid from our city, and then there was an interview taken by all the board members, because at that time executive committee used to decide which city will organize the conference. So that is how 2007 I got it in Chennai, and 2008 I did the first national conference as an organizing secretary in Bhopal, and that was a huge success. Obviously, at that time, I was not as a regular executive committee member. I was a co-opted member, but immediately in 2009, I got elected as executive committee member in ISCCM. And after that, continuously I opted different posts, two times executive, then followed by vice president, then secretary college, secretary, general secretary, society, then again vice chancellor, and finally the president. So no look back after that, and constantly, and I have seen all those senior members who are currently those who have served this ISCCM as presidents, their contribution I have very seen from very close, watchful eyes, that how they have performed, how they have made this ISCCM to grow from zero to today's state, where actually we are proud that yes, we are one of those societies in the entire world, which actually, if you say we are going to become the third largest economy in the world, I'll say probably we are the third largest and biggest society to be recognized as far as entire world is concerned.
Excellent answer, sir. That is an inspiration and a clear message and a pathway for further development also. Thank you, sir.